Thank you, Mr. Chairman. I yield myself such time as I may consume.
The gentleman is recognized.
Thank you, Mr. Chairman. Americans with disabilities have always faced significant barriers to health care. A decade ago, an insurer could charge a family an exorbitant amount to cover a child merely because the child had asthma. An insurer could tell an amputee that they would cover her medical equipment except her medical treatment except for the treatment related to her amputated limb. Or an insurer could flat out deny coverage to the victim of an accidental shooting at the age of 16 simply because he had a spinal cord injury. Essentially, insurers could legally discriminate against individuals with disabilities and face no consequences. That is absolutely outrageous, Mr. Chairman. Then the Congress finally passed the Affordable Care Act and started to bring those barriers down. For the first time, people with pre-existing health conditions, including the one in 4 Americans with disability, no longer had to worry about whether they would be denied comprehensive health insurance. Coverage of essential health benefits meant a mother with a traumatic brain injury could obtain rehabilitative services and learn how to walk. A man with Parkinson's could access medication to control his tremors. A child with a vision impairment could visit an eye doctor to prevent further vision loss. And this access to health care is vital because when Americans with disabilities are healthy, they can stay active with their families, pursue fulfilling careers, and engage in their communities. Unfortunately, the Trump administration is once again working to raise barriers to health coverage instead of working to eliminate them. The administration's October 2018 guidance encourages states to allow insurers to offer short-term limited duration plans that do not have to provide coverage of pre-existing conditions or essential health benefits. This means insurers offering these junk plans can discriminate against disabled individuals by charging astronomical prices, excluding necessary treatments from coverage, or denying an individual health insurance altogether. This is outrageous. If you're having deja vu, it's because this is exactly what was happening to Americans with disabilities before the passage of the Affordable Care Act. The amendment that I'm offering today makes clear exactly what people with disabilities have to lose if states act on the administration's guidance. I have spent my near 2 decades in Congress championing efforts to eliminate barriers to access and integration for people with disabilities and help my fellow Americans understand their great potential. But fundamentally, none of that means that matters if people with disabilities are not healthy because we deny them coverage to treat their conditions. The damage from the administration's guidance would be borne disproportionately by the disabilities community, and my amendment makes that clear. Whether someone is born with a disability, develops a disability, or becomes disabled due to an accident, that disability, I assure you, happened by chance, not by choice. Even the healthiest 30-year-old today could be in a car accident tonight and wake up with a lifelong disability tomorrow. And if that 30-year-old had one of these junk plans, much of that cost of that care would fall on his or her own shoulders, and they would be on their own. I had hoped that 9 years after the passage of the Affordable Care Act, I would no longer have to come here and defend the idea that quality, affordable health care is a right and not a privilege. But once again, here we are. Mr. Chairman, I support my friend Congresswoman Custer's underlying legislation, and I ask my colleagues to support my amendment to make clear the damage the Trump administration's guidance would cause to people with disabilities. With that, I reserve the balance of my time.
The gentleman reserves.